Hello, students. This is the third part of our nutrition PowerPoint. So, the second part was quite longer than the first part. So, this is the third part. And in the second part, we stopped at this slide, which is providing parenteral nutrition. And we were discussing, how to initiate the parenteral nutrition. And I keep on saying parenterals because I want to give emphasis on how this kind of nutrition is not using the digestive tract and it's using vein. This kind of nutrition, the parenteral nutrition, it can be also given through PIC line, and so PIC line is actually also a central line, like it is inserted peripherally, but actually it's using the it's the axis is towards heart. Um, just as we put NG tube or we put any gastrostomy tube or anything, and if either we put NG tube or doctor put surgically the gastrostomy tube, the we need to see the image of it. We need to have an X-ray to see that whether that tube or something foreign which we put inside the patient's body is in its proper place. The same goes with this. So if a catheter has been inserted inside the patient's body and it's a central line, uh, the most important thing is that chest X-ray needs to be done. If it's a central line, chest X-ray needs to be done to see that no misplacement has happened and it is in its proper place. Um, when you are giving this parenteral nutrition, the most important thing is that you need to know the formula. Now, what is formula? When they have this parenteral nutrition, the bag, which has all the ingredients as specified by the doctor, that bag is known as formula. So you can hear nurses saying TPN formula, you know. So that formula ordered, which is being given to the patient must match the doctor's order. And it is done in consultation with nutritionist, but the doctor is the one who will be ordering it, and this formula is provided at a certain specified rate using the same the infusion pump over a course of day, and usually around 12 hours maybe. And if patient is doing it at home, then he will also use this formula. This formula will be going in his body daily, maybe all day for 10 or 12 hours. And usually the 10 or 12 hours of formula going inside patient's body, they prefer doing it at night, because then to give patient more freedom of movement on the floor also. Usually the TPN, they prefer starting it at night, where it is going for like 10 or 12 hours. Now, the most important thing about the care of this parenteral nutrition is, for nurses, is that they need to focus on certain goals for this parenteral nutrition. The first one is preventing infection. So, the the site can become infected, or the IV access, it can, due to a lot of caustic fluids going inside the body, and then due to lack of proper care, can become infected. You have to maintain the whole parenteral system, and when I say the whole parenteral system, it means the tube, the pump, matching the formula, looking at the site, noting the time. So all this is important. Now, sometimes because there are so many ingredients, like so many minerals, vitamins, etc., in that bag, that there are some chances that sometimes electrolyte or fluid balance complications can happen. So the nurse needs to watch that too, and the The most important is that the patient's nutritional and fluid needs are being met. And then it is very, like, suppose first day you hung this TPN, and whether the second day TPN needs to be there or not, that is a continued assessment by you. So you have to evaluate the continued need for parenteral nutrition, or to see that now the patient can be transition from parenteral nutrition to enteral nutrition or oral intake. So if you can assess that, you can, it's your job to assess it and pass this information to the doctor. Um, if patient is going on home on this parenteral nutrition, so a lot of planning needs to be done, a lot of patient education, and if there is somebody significant as a caregiver, then giving teaching to that family member is also important. And then of course the most important job is you support the patient and family members, because they'll be doing some major lifestyle changes because of this parenteral nutrition, because it'll go for many hours. Patient will not be eating anything by mouth, so the support needs to be there. um, and it's your job to assess whether the patient is being able to tolerate this formula or not, whether there any adjustment needs to be done, and whether the nutrition is provided its intended result, what the doctor had prescribed for. And and when, like, as usual, the lab work is done on patient, but when the TPN is going on, PN or TPN is going on, uh, we need to assess the actual electrolyte abnormalities too. You need to know patient's fluid balance, his weight, and how and whether this intended nutrition is helping patient or not. Um, on this slide, you see uh, blood sugar machine, and this is usually the machine which patients have at home, and on the floor it looks different. Um, One of the major contents of this parenteral nutrition is glucose. So blood glucose monitoring is very important part of this patient's uh, care on the floor. So you will get many questions by NCLEX where the patient is asking a nurse, why I'm not diabetic, so why you're doing my blood sugar check? And this is the reason why, because he's getting this TPN and it's very highly dextrose or glucose concentrated. So it's very important that the nurse does periodically, you know, the blood sugar check. Now this blood sugar check will not be as aggressive as the blood sugar check for the diabetic patient, so it won't be that frequent. So okay, let's go to the next slide. No, we had a case study going on, and for Miss Gonzalez, and the nutritional management for Miss Gonzalez, who was a patient who came to the floor after suffering from stroke, is we will insert the feeding tube as ordered. We will start the enteral feeding as prescribed. We will advance tube feedings as tolerated, and we will monitor for patient's tolerance towards these feedings. Because she's stroke patient and her swallow capability is affected, we will go for also very, very important aspiration precautions. And so we will position Mrs. Gonzalez with head of bed elevated a minimum of 30 degrees. We will check the tube placement every 4 to 6 hours. And this is, we're talking about the NG tube, the feeding tube we have inserted. We will check the gastric residual volume every 4 hours. And after doing a 2-1-1, um, you must be aware, maybe due to your skills lab, that how you do your how you check your placement and residual on NG tube when the patient has NG tube. And another important management will be continuing with speech therapy. Now, speech therapy, anytime patient has speech therapy, his swallow eval, his continued work on his facial muscles, his eating muscles will be done by language and speech pathologists. So either they're called language and speech pathologists, I think this, or speech therapist. Um, now, when you have this, and it's kind of, some of it some of it you might be thinking why we are doing this, and all these nursing interventions which you are doing is that to help patient with his nutrition. And if we are doing any enteral tube feeding, so when you're using the NG tube, it's enteral tube feeding because it is using the digestive tract. It will allow for the safe, you know, administration of nutrients until the patient's swallowing capability is, rehabilitated with the help of speech language pathologists. So that's why we are doing it. Um, and if we are doing the tube feeding on this patient, Ms. Gonzalez, we will do it because it's new to Ms. Gonzalez. So we will, in the beginning, it will be done at a very low rate of infusion, and then slowly it will be done for maximum tolerance. Uh, Now, suppose Ms. Gonzalez is not able to tolerate these two feedings and she needs a reevaluation, what can be done about the nutrition. Now, some of the signs, which common signs, which you see in any patients going through these tube feedings, if complications happen or intolerance happen, is they will feel some kind of abdominal pain, and then when you pull back on the syringe, you will see large volume of gastric residuals and also diarrhea. They are signs of feeding intolerance. Uh, Now, with stroke patients, with swallowing problems, head of bed elevation uh, will decrease the risk for aspiration. And I want you to note the head of bed will be elevated a minimum of 30 degrees. So it can go from 30 to 40 degrees. Uh, Tube placement, you should check tube placement every 4 to 6 hours. If you don't check tube placement every 4 to 6 hours, it increases the risk for aspiration. Uh, Now, gastric residual volume, which you are checking every 4 hours, it indicates if gastric emptying is delayed. So delayed gastric emptying will increase again the risk for aspiration. Regularly provided a speech therapy will help the patient in regaining that ability to swallow foods and liquids. Now, what speech therapy will do, if you get the opportunity to watch speech therapy doing working with stroke patients, so it's very interesting. She will do trials of various foods. So she will get foods with different consistencies, foods and liquids, and she will tell patient to have it, and then she'll see how much capability patient has in swallowing this. And aspiration of foods and liquids, if it really happens, it can lead to chest congestion and pneumonia. So preventing aspiration is very important. Let's go to the next slide. Restorative and continuing care. So I give restorative another name, rehabilitating. Okay, so now patients discharged from a hospital, when they are discharged with the hospital with certain diet prescription, they need a lot of dietary education because they have to plan meals that will meet their specified need. Now, restorative care is usually done as regard to nutrition immediately after surgery or after hospitalization, or it can be just done as a regular patient care on the floor. Um, Now, the diet therapy in disease, now when they use the word medical nutrition therapy, it means that they are using special diet uh, used as a therapy to treat an illness. So, diet used as a therapy to treat an illness is, in other word, medical nutrition therapy. And it is medical because the now doctor has got involved. And it is trying to, you know, speed up it is trying to bring the patient's metabolism uh, to its original state. And because if we won't take care of this diet problem, or if we don't initiate medical nutrition therapy, then patients will have problems with his diseases, or situations can get worse. Home care, so patient is home care on these special diet therapy, education, assessment, troubleshooting, problem prevention, help patient transition to oral intake when needed. So if somebody is going to home on parenteral nutrition, if somebody going home on tube feedings, you need to educate both the patient, if he's alert, as well as the family member, how to troubleshoot if certain things happen, how to check the gastric residual and all that, because they need to know exactly how you do the patient care for these feedings. Like you tell them, that you keep checking the feeding tube, you keep taking patient's weight, his blood sugar, and you watch for signs of infection, and and to call for help when needed. Okay. Now, Matt, the nursing student, as we were discussing with Ms. Gonzalez, he must keep in mind that Mrs. Gonzalez will progress to restorative care and return to oral feedings, and also must consider cultural preferences. Matt knows that food safety is an important issue. So now these are what we are discussing right now is outcomes. So in the earlier slide, we had goals for Ms. Gonzalez. In this slides, we have outcome. So the expected outcomes Matt has set for Ms. Gonzalez are, you know, that she will progress to restorative care and return to oral feeding. So until her swallow capability is, coming back, we will be using the tube feedings. And while Matt is doing it, he is also keeping in view the patient's cultural, preferences. Uh, because how we see, how we dress, how we eat, how we look is is more or less influenced by our background, and some of us is also influenced by our cultural preferences. So Matt understands that nutrition is important. At the same time, he wants to respect the uh, patients and family members' feelings too. Matt will consult the dietitian, and together they can develop a teaching plan regarding food safety for the foods that Mrs. Gonzalez family will be preparing at home. Now, what expected outcomes would Matt set for the teaching session? Now, the expected outcome which Matt can set for the teaching sessions are, like if you are um, that, of course, hand hygiene, so washing hands, uh, you know, like cleaning the surface on which they are preparing meals, and then cooking meat, poultry, fish, and eggs at 180 degrees, washing fresh fruit and vegetables, refrigerating foods at 40 degrees within 2 hours of cooking. And I think in your Potter and Perry book, there is a whole laundry list of, what things can be done to, for the teaching session. If the diet therapy is continuing till home, how to clean microwave, fridge, and how to even wash the dishcloths or towels if they are being used to clean the dishes. Now, Matt can also assess family caregivers, capability or comprehension level in, in preparing all these and taking directions, and preparing all these uh, food and also taking directions. And then, if there's a home health nurse, she can go to this patient's house and she can see if there is any foodborne illnesses possibility of having it due to not keeping everything clean. Okay, let's go to the nursing. Let's go to the next slide. Now, what nursing actions are appropriate for evaluating whether goals have been met? So, nursing actions to verify achievements of the outcomes are to ask Mrs. Gonzalez if she's experiencing any GI comfort, like abdominal pain or anything. Then, weighing Mrs. Gonzalez to check the weight of Mrs. Gonzalez weekly, monitor Mrs. Gonzalez lab values, and ask the speech language pathologist about the Mrs. Gonzalez swallowing rehab. So, and also, among all this, we need to consider the patient's perspective too. And as you all know, you have been doing nursing diagnosis for long, that your outcomes should always be measurable. They should have a timeline. And when they say consult with interdisciplinary staff, it means here the speech language pathologist. Let's go to the next slide. Now, evaluation. An ongoing evaluation measures the value of our activities in meeting a patient's nutritional needs. You need to allow enough time uh, to test a nursing approach through a problem, because nutritional improvement takes time. Evaluation of clinical progress will include the objective data such as weight gain or improved any lab parameters, or any subjective data such as patient saying that I like to eat certain foods now as compared to earlier. So the patient is showing improvement in his food choices, or he's showing that he has improved in his intake of a certain food types which doctor wants. Then, if the outcomes are not met, you reassess the patient to determine, what went wrong, or if the patient has any question or any important data was missed. Mm. Now, nutritional interventions, they often depend on patients' willingness and ability to change behavior patterns and learn new patterns. Now, if a patient is not fully committed to the expected changes, the intervention will not always be successful. So the patient's willingness and also what we expect from patient is important. So we will give patient the freedom to make some informed choices. At the same time, we have to do it, this medical nutrition diet therapy, we have to do it according to doctor's specification too. And if necessary, we can divide the teaching sessions in different settings. And if you get a chance to watch any nutritionist on the floor anytime in future, uh, then you can tell her, I want to shadow you, or just want to, so do you have any teachings, patient teachings, I want to follow you. And you can watch nutritionist how she's doing patient teaching. Let's go to the next slide. Now, Matt sees Mrs. Gonzalez before discharge to a restorative care facility for rehab before returning home. Mrs. Gonzalez now is able to consume all of her required nutrients with a ground diet and nectar thickened liquids. Matt removes the feeding tube in preparation for her transport to the new facility. Matt advises Mrs. Gonzalez to continue the care plan and emphasizes that it is important to continue speech therapy. Now, I think this is kind of what is happening is on basis of your nursing care plan, this is Matt is doing evaluation. So now Matt also will discuss the importance of compliance with these diet modifications until swallowing function is returning normally, returning completely. Uh, I mean, he can write as a patient and family educated on patient illness, and also the interventions to improve motor function and independence, feeding tube in use until patient is rehabilitated, speech language pathologists working with patient to improve communication skills. So, mm, uh, the fact is that you do evaluation at the same time you document on this patient. And of course, whenever patient is going with any kind of teaching to his home, a lot of documentation needs to be done that you have done your teaching, patient understands it, or his important family member understands it, and they have demonstrated their understanding. You write this down, so that becomes part of patient's file, and it shows that you have done your part, before the patient leaves the floor. Let's go to the next slide. Now, these are some of the safety guidelines. Ensuring patient safety is a very important part of you as a professional nurse. To ensure patient safety, we communicate clearly with members of all the healthcare team, and we will talk to speech language pathologists. We'll talk to the if anything is needed, we'll talk to our case manager or social worker, and use the best evidence when making decisions about this patient care. Um, we have to label the enteral equipment. Enteral equipment will be what? The tube, the bag, the feeding, and it should have a patient name, room number, formula name, date, and time of initiation, and nurse initials. So on the floor, we don't label the tubing with patient's name, but they do have, if the label, when it was changed. But formula will have everything: patient's name, room number, the formula, rate, and when it was started, and also the nurse initials. And of course, you'll go to the same, think of it like a medication. So you will ensure right patient, right formula, right tube. You will elevate the head of the bed to minimum of 30 to 40 degrees. Now, here it says can be from 30 to 45 degrees. And trace all lines and tubing back to patients. Monitor tube placement. Monitoring the placement is very important part too. And auscultation is not a reliable method for verification of NG tube. So just so you know, auscultation is not a reliable method for verification of NG tube, because tube might by mistake go in the lungs, pharynx, or esophagus. So it's very important the chest x-ray should be done to ensure that the tube is in its correct place. And tracing all lines and tubing back to patient, this hmm, make me remember that Joint Commission has made because we as educators, not in this college, but when I was in my previous college, like Fresno City College, um, they have a lot of resources. Your school has good lab structure, but they also have a lot of good resources. And as an educator, we showed students some PowerPoint which Joint Commission had sent us, and it showed what are the mistakes all new grad RNs are making. So what happened was that the patient has a central line and the patient has a feeding tube. Now the feeding was supposed to go in the feeding tube. Okay, now feeding tube, I'm talking about this maybe something going directly to your abdomen wall. So gastrostomy tube, jejunostomy tube, anything which is going direct to your abdominal wall. I'm not talking about NG tube right now. So this is, the patient has this tube, and the patient also has central line. Central line is that IV axis which you can usually see on the upper left body around your heart. So he also has this what do you say, central line, and this central line has, I think it was Mediport or tunnel catheter, I don't remember, but it was there. Now the nurse did, because whenever you were putting anything in any line, you need to trace it back to the patient, to where it's coming from. So she was in a hurry and she put the feeding in that central line which is going to the heart. So the feeding went to the heart, and there was so much of complications happened and the patient died. So it's very important when, and this is your first semester, many times we are saying trace all lines and tubing back to patient, so it has some meaning. So always, so if you might happen that in beginning you were on med surg floors and you are dealing with only one or two tubes and you don't care, but gradually you might be interested in going to ICU or NICU or ER or PACU, and where patients have a lot of lines. And if you get this habit of checking all lines and tubing back to patient from your med surg floor, you get that practice and you get that extra eye to look at things differently. So monitor all lines and tubing back to patients is very, very important. Okay, let's go to the next slide. This is the last slide of the nutrition PowerPoint, but I think I have one more. Uh, I have one more 7 slide PowerPoint. It says nursing considerations, and I will post that also with the nutrition slide. But for that, there will be no video because it is very self-explanatory. And if you have any questions on that, you can ask me. It just tells you, the same thing what I have said here, but there is some extra information on dysphagia over there on those slides too. So for nutrition, you will have this whole PowerPoint in 3 videos. Plus, you will have that mm, second PowerPoint, which is special nursing concentrations. And some of the stuff is repeated, what I have said here. and the most important is dysphagia. Okay. Dysphagia slide on that second nutrition PowerPoint. Okay, so this brings me to my video recording for nutrition. Okay.